Being a paramedic for as long as I have, there's sometimes that I'm ask myself some questions, or I have some questions about some treatment pathways that we do that just kind of keep me up at night. I do some extensive research until wee hours of the morning just because I don't understand why we do this, right? There's a fact that I learn about something that in our treatment that's like, ooh, that doesn't really make sense. So to say I go down some rabbit holes would be an understatement, right? The last thing that got me, normal saline in your septic patients for fluid resuscitation, right? We've all seen that patient. We've all seen that patient that has a MAP that's 10, blood pressure's in the tank, they're unresponsive, they're on a ventilator, they've been at the hospital that you're transferring from for 4 hours, and they've got no better. We've got no increase of blood pressure. They're on every pressor known to man. You name it, right? Do you know what the pH value of normal saline is? It's 5.5. Okay. What is the pH value of blood? 7.35 to 7.45. I'm not that smart, but I do know that 5.5 is not 7.35 to 7.45. I do know that, right? And we're giving at least 30 cc's, 30 milliliters per kilogram for fluid resuscitation and sepsis. That math isn't mathing for me right now. I don't understand. It doesn't make sense. We've got LR that does less effect on the blood pH. We've got newer fluids out there, balanced crystalloids like Plasma-Lyte, Normasol. There's so many different ones out there now. Buy those. I don't care if they're more expensive, personally, and I don't think you guys probably care very much either, right? Did you guys know that 25 cents difference between normal saline and lactated ringer? Are there some contraindications for LR? Yes, of course. And we could talk about that in another episode. But what I do know is that when we're giving 30 milliliters per kilogram of a 5.5 pH value fluid to a metabolically acidotic septic patient, all we're doing is exacerbating that acidosis to a level of acidosis that those potassium compounds shift out of the cell. All right, so now we've got hyperkalemia, okay, which we know wreaks havoc on the cardiovascular system and among other things, right? Why are we doing this? Why have we not advocated for that Plasma-Lyte, for that Normasol, or for nothing else, lactated ringer? Okay, that's just for our septic patients. Okay, we use fluid resuscitation on traumas all the time, and I'm sure you've seen the patient as well that we've given them enough normal saline that their blood turns pink, right? What do you think their pH value is at that point? How do you think they're sitting metabolically? Okay, there's no physiologic proof that normal saline should be used that I can find. I've done a lot of research and I can't find it. The only thing I can find is that it's cheaper and it's readily available. That's why we use it. Right? So it's cheap, easy to get. So that's why. Well, that's not good enough for me. I don't know about you guys. So, we need to know that there's other things out there. There's other options out there that could more than likely be better, right? Nearly all available physiologic, animal, and clinical data suggest that these balanced crystalloids are superior to normal saline. Okay? I can't find the research saying otherwise. It may be out there, but I can't find it, and I was in that rabbit hole. Okay, so you guys comment. Let me know if you know something otherwise, or if you agree with me or disagree with me. Let me know what you think. Help me figure this out, and we'll come back next week and we'll talk about it and maybe dig into it a little bit further or cover a new topic. Who knows? So. But let me know what you guys think, and above all else, please stay safe out there. All right, take care.